Our heart goes out to them and their families. Structural and functional correlation in the diagnosis of glaucoma is vital for diagnosis of glaucoma. The aim is to give lucid instructions on how not to miss glaucoma in your clinical setup. In India, up to 90% glaucoma is undetected and about 50% is overdiagnosed. Hence, there is a need to impart practical clinical skills that shall help in increased detection and reduction of overdiagnosis. Structural and functional correlation in the diagnosis of glaucoma involves at the beginning, the moment the patient comes to you in your clinic, what is the thing that you do first? The slit lamp examination. To lead you towards glaucoma, the most important thing that you must do and develop and make it a habit is to see the anterior chamber depth. The pupil striatus, the pseudo exfoliation, atrophic patches on iris, Krukenbrad spingle, etc. And Van Herrick's test is that Van Herrick test is the way to go to see for the depth of the anterior chamber. The highlights of this, after this, will be to see for the optic disc. And here, Dr. Medha Prabhudesai Nitin will be speaking on evaluation of optic disc in glaucoma and OD suspects. Structural evaluation of optic disc and the must-look-out signs shall be outlined. The next talk will be on the understanding posterior segment OCT in glaucoma along with structural and functional correlation. If you suspect something in the optic disc, how to correlate it structurally by imaging technology, Dr. Amit Porwal will highlight the role of imaging for confirmation of structural defects, especially in the disc suspects. Then, interpretation and functional correlation of structural defects in glaucoma and visual field that I shall be taking over, and I will be speaking on correlation of diagnosed structural defects with functional changes in visual fields, including correct interpretation of a field printout. But at the outset, all speakers shall give a take-home message and also demonstrate structural and functional correlation in an interactive style. The expected end result of this session shall be that the delegate be able to confidently look out for and diagnose glaucoma. At the outset, we have a keynote address by Dr. Neeru Gupta in this session. She will be speaking on glaucoma damage from eye to the brain, implications for treatment. I welcome Dr. Neeru Gupta to give her keynote address. Thank you.